Okay. Hey, thank you, Mr. Chair. I appreciate it. Dr. Fink, Jeffrey Epstein and Ghislaine Maxwell were found guilty of running a child sex trafficking ring where they abused at least 1,000 young girls over decades. In a Fox News interview with Jesse Waters, RFK admitted to flying on Epstein's plane, the Lolita Express, at least twice. Dr. Fink, you've never been on Epstein's plane, I take it, right?
Thank you for the question, Congressman. No, I have not. And I'll appreciate the question. I would really love to talk about chronic disease today.
We're going to get to that. Here are the flight logs showing the exact flights that RFK was on with Jeffrey Epstein. Now, RFK is also excusing his friendship with Epstein in the following clip. Can you turn up the... Okay, I'll read the clip here. He said the following in his podcast. I ran into everybody in New York. I knew Harvey Weinstein. I knew Roger Ailes. O.J. Simpson came to my house. Bill Cosby came to my house. Dr. Fink, you've never socialized with Harvey Weinstein or Roger Ailes, I take it?
No, I have not.
You've never had Bill Cosby or O.J. Simpson to your home, right?
No, I have not.
In that same podcast, RFK described Ghislaine Maxwell saying, quote, she was always wonderful to me and, you know, kind. You wouldn't call her kind, would you?
Representative, I respect these questions, but I really don't think that this is the time to go into this. We have a chronic disease crisis in our country.
You wouldn't call Ghislaine Maxwell kind, would you? Who ran a child sex trafficking ring that abused more than 1,000 girls.
No, I would not. And I also would say that we have a chronic disease crisis in our country right now, and we need to address it.
We have a crisis. We're going to get to that. The fact that RFK hosted and socialized with murderers, sex traffickers, and serial rapists is deeply disturbing. That's why I'm going to seek to have this committee interview Secretary Kennedy under oath about his relationships with Jeffrey Epstein and Ghislaine Maxwell. Let me turn to my next topic, the 988 suicide hotline. Dr. Fink, you're the acting assistant secretary of HHS, right?
Yes, I am.
And SAMHSA and the CDC are components of HHS, correct?
Yes, they are agencies within HHS.
This September has been deemed and recognized by SAMHSA as Suicide Prevention Month. The CDC, for 3 different years under President Trump, namely 2017, 2018, and 2020, concluded that LGBTQ youth are about 4 times more likely to attempt suicide than their peers. You don't dispute those stats, right?
No, I do not. There are also many other stats that we could discuss here today to address chronic disease.
SAMHSA reported that in June 2025, nearly 70,000 calls were answered by this LGBTQ youth hotline, doubling the number of calls that had been received just 2 years earlier. You don't dispute those stats, right?
With all due respect, Representative, I do not oversee SAMHSA, and so I am not able to comment on the number of calls.
Do you dispute that, though? Do you dispute what SAMHSA just put out this June?
I'm not disputing it, but I'm just telling
okay,
you
that's what I want to
do not
ask
oversee
you,
SAMHSA.
okay? Despite this rising demand, when I led a bipartisan letter strongly supporting this hotline, HHS responded that it had ended this specialized hotline, ending this specialized hotline based on anti-DEI efforts. You don't dispute that, right? This is your agency, ma'am. We're talking about children on the verge of committing suicide.
We are here to talk about the metabolic chronic disease epidemic.
No, we're here to talk about children as well and their health. And ma'am, let's just be clear. At a time when LGBTQ youth and children are reaching out for help like never before, this administration is shutting the door. This hearing is about meals and pills, but it should also be, Mr. Chairman, about fewer suicides among our children. Let me turn to my next topic, and this is about healthy food. Dr. Studi, USDA dietary guidelines recommend Americans at every stage of life should eat, quote, nutrient-dense foods. That includes, I take it, eating your veggies, right, Dr. Studi?
Yes.
Seemingly at odds with that mission, Axios reports that President Trump's economic policies, namely tariffs, have caused wholesale vegetable prices to go up by 40% in just 1 month. And I just went and bought some today with my staff. These peppers and this broccoli at the wholesale level are skyrocketing in prices, Dr. Studi. You don't dispute that Axios reported a 40% increase in wholesale prices for vegetables, right?
I'm not aware of their reporting.
You don't dispute their statistics, right?
I don't have specifics on prices. I'm here to discuss in my capacity as an expert on childhood nutrition, but we do have an entire agency, the Economic Research Service, who I'm sure could provide more information.
I'm just saying you don't dispute the statistics.
I have no awareness of this.
That's better. You don't have an awareness
statistics.
of it. Dr. Fink, in your testimony, you wrote that HHS priority is to, quote, improve federal nutrition programs for low-income families. But healthy foods are costing more for everybody at this point. And according to CBO, this administration is going to cut SNAP benefits such that at least 300,000 families living with children 14 and older will lose food assistance. You don't dispute that, right, Dr. Fink?
Representative, we, as Dr. Studi shared, we, between HHS and the USDA, are collaborating to take SNAP to the next level. Our goal is to ensure that children have access to wholesome, nutritious food.
And they're losing
not
access,
poison
ma'am.
them.
They're losing access because your administration is cutting SNAP benefits.
With all due respect, sir, we are challenging states, as Dr. Studi said, to submit waivers so that we do not poison our children with junk food and sugary
This is
soda.
not junk food.
I am
This
not
is going up
stating that.
40% in cost, and you're cutting the supports to buy this stuff.
Through the SNAP program, we are offering waivers to states so that they can provide children with wholesome, nutritious foods. And we are really emphasizing that we cannot continue to provide soda and junk food and call that a quote-unquote nutrition program.
Thank you.